Illinois public health officials are reporting more than 11,000 new COVID cases for the first time since December 2020, and that's when vaccines were not widely available. The spike in cases comes amid concerns of the Omicron variant, which has not yet been detected in Illinois. So how will all of this factor into COVID guidance from the city and recommendations for holiday travel? Joining us now with more is Dr. Allison Arwady, Commissioner of Chicago's Department of Public Health. Dr. Arwady, thanks for being here as always. So this 11,000 plus caseload today, largest in about a year, is this a post-Thanksgiving bump?
It's certainly part of it is a post-Thanksgiving bump. As you know, we've been on an increase with cases here for a number of weeks, but yes, across the state and here in Chicago, we saw numbers of cases being reported that were higher than we've seen since last December to January. Some of that is certainly the result of people gathering and traveling over Thanksgiving. Some of that is still, unfortunately, though, being driven by people who aren't vaccinated yet and were exposed over the holiday.
And when you see this bump, does it call for a discussion on potentially harsher mitigation measures again, like capacity limits or even shutdowns?
Yeah, that's certainly not what we're talking about right now. Obviously, we're watching for Omicron closely and really wanting to learn a lot over the next couple of weeks about how concerned we need to be about that particular variant. But I'm worried enough about Delta here right now. We're not at a point which is different than a year ago when we didn't have a vaccine. I still, here in Chicago, almost 99% of the more than 6,500 deaths that we've had from COVID have been in people who are unvaccinated. And the fact that we can use vaccine and importantly boosters to help keep people out of the hospital. And I do expect with some of these new oral medications, those have the potential to be a big deal to also help people if they do get infected, stay out of the hospital. So we're not looking at more shutdowns right now. We're certainly monitoring closely and really watching hospital capacity especially.
So a large number, but the test positivity rate is a little bit over 5. It's been much higher than that in the past. With a 58% of the population vaccinated, do you anticipate that positivity rate to go up more?
I think it might. Positivity is mostly, to my mind, about are you testing enough? Here in the city of Chicago, we're still holding under that 5%. We're at about 3.7, and then as you say, across the state, 5 to 6. We want to see it stay under 5%. Mostly that tells us we're testing enough to really be able to detect the surges. And so when we see it go over 5, for me, that's an indication that you've got to step up some additional testing. And I think, as a reminder, the positivity is literally the percent of all of the tests that you're doing that are testing positive. So the combination of an increase in cases and an increase in positivity tells us that this is not just an artifact related to testing over Thanksgiving. This is unfortunately a continued increased surge.
Speaking of testing, President Biden today outlined his winter strategy. Part of that is free at-home testing. As you know, it's sometimes been hard to come by in Chicago. Aldermanic offices have run out of those at-home tests. Is there a plan to replenish those so residents can get access to that pretty easily?
Yeah, so I'm really pleased by that move by the federal government today. I love the at-home tests. I keep them at home. I order them on, online, or I pick them up at a pharmacy. So I always have them available. So you can just do the rapid at home if anybody's got a cold, if you're going to be seeing somebody with an underlying condition. And right now you can buy 2 for about $23, $24. But we know that there are people for whom that is not accessible. In Chicago, as you noted, we did distribute them to aldermanic offices in advance of the Thanksgiving holiday. We also, our door-to-door work in a lot of the hardest hit neighborhoods or some of the lowest income neighborhoods, we've certainly been distributing them. But I think the work to really bring the cost down there, have insurance cover it, make it more available, and importantly, increase the supply. It's kind of like vaccine early on. Even when Chicago, the health department tries to order additional at-home tests, it takes usually weeks at this point to get it. So I'm really pleased by doubling down on that. I think it's going to be an important part of our strategy, along with some of these new oral medications moving forward.
The president also announced doubling down on testing for those who are traveling, especially by air. Is that going to help keep these numbers down?
I think any testing can help. Really, though, what I always remind people is that testing is just detecting people who are already infected with COVID. The most important thing is continuing to push on vaccine. And honestly, where international travel is typically requiring proof of vaccination, that to me is even more important. The test is another piece that helps with that. And certainly we want to detect people. And if the idea of testing before you travel helps limit the risk that you would then bring, that you often are in contact with a lot of folks who you would not normally be during travel. So I'm in support of increased testing, of course, but always really the answer here is still vaccine and then getting boosters for people who are 6 months post Moderna or Pfizer or 2 months post J&J.
You talked about further restrictions not being discussed right now. You have cities like New York who have imposed mandatory vaccination status if you want to go to restaurants or clubs or things like that. Is that something that the mayor's administration is discussing here in Chicago? Because it's still not the case quite yet.
That's right. Yes. No, of course we are. And I think when I think about any restriction type setting, it's more anything that's encouraging vaccination would be more than trying to do the capacity limits. We don't want to have to shut things down. We've seen many settings here in Chicago, as you know, voluntarily do this. So really all of the theaters, the music venues are doing this. Really many large gatherings, especially with this surge, we've been very strongly encouraging a vaccine requirement, if not a vaccine requirement, at least a vaccine or a recent negative test. And I think that actually is a good strategy to continue doubling down on. We've not made it a requirement broadly outside of larger events, et cetera, at this point. But that would certainly be the sort of thing we would consider before doing capacity limits and things like that. Again, watching a little bit what's happening with the variant.
All right, so
that's what I'm thinking right now.
So perhaps that's on the table. And with the holidays coming, what's your advice for families who are looking to travel and gather?
Yeah, so it's really not different at this point from what it was for Thanksgiving. The safest thing is to be gathering with people who are as vaccinated as they can be for their age. So that means kids 5 and up, really by the holiday season at the end of December, will have the opportunity to have been fully vaccinated. For the younger kids, I'm comfortable gathering with them as long as their parents and relatives have been doing it. And if people are going to be gathering who are not fully vaccinated, it's critical that testing is a part of that. I would really be encouraging any gathering where everybody's not vaccinated to just be doing that home test that morning. And honestly, for an extra set of protection, if we are having a little more trouble with the variant by that point, which we very well may be, we may want even more testing in that setting. We don't want people worrying about COVID. We don't want it really overlaying their holiday seasons. And I think as long as people continue to do the things that have gotten us this far, get yourself boosted ahead of the holiday is sort of that last piece of advice, so that we're all as protected as we can be. And this doesn't have to be another holiday season that is completely off the rails because of COVID.
Those boosters are widely available at this point. Dr. Arty, while I have you, I have to ask you about this other item in the news. Activists from the Southeast side are calling on you and the Department of Public Health to deny a permit for a metal shredding facility in that community for the company Reserve Management Group. Do you have a position yet on that permit?
So we are in the middle of a health impact assessment, which the U.S. Environmental Protection Agency has asked us to do. We've been gathering additional information, working with the scientists at the EPA, collecting community input. There's another meeting that's happening next week, and we are still very much in the middle of this process. I appreciate everybody who has been weighing in on that, but we have to finish the process of the assessment. There's a formal process that goes along with that, and then, of course, a decision will be made.
All right, Dr. Allison Arwady, thank you so much for joining us, as always.
Thank you.